Welcome to the 6th Annual Leadership Breakfast Meeting, organized and facilitated by the National Health Commissioners Forum and PMG-MAN.
Health takes a while before it gets into a negative trend, but then people then die, and that death is recorded as a mortality. So there is a role that we have to play in ensuring that the DMAs do what is important. 3 decisions are on the agenda this morning: scale, distribution, and financing. And each of them requires something specific from the principals on this table. Again, to my colleagues, I'm asking for named commitments, not expression of interest, not indication of intention, right, or commitments. A timeline to establish your DMAs for every commissioner whose state has not done that. A timeline to commit to joining the group framework for the 9 states that are yet to do that as well. For the CEOs and MDs, I'm asking for named production and onboarding commitments. The $1 billion allocation gives you a planning basis. What I'm asking you to do with it is tell this room specifically what your company will produce, the volumes, which states, and in the next procurement cycle. And from all of us together, I'm asking for a financing decision.
Over the past years, one of the things that we've tried to achieve as an organization is to ensure that we're able to open up the market both from the supplier side and demand side to ensure that we have essential medicines available on every table in Nigeria, irrespective of where they are located.
The GPF framework, as in relationship with PMG-MAN, will strengthen local manufacturing and strengthen the health footprint in Nigeria, as it were, because now the states who are in charge of the primary health care and in charge of basic needs of providing health for the citizenry will be able to get these drugs directly from the manufacturers at a reasonable price. So what the GPF is doing is cutting out middlemen. So it goes straight from the manufacturers to the table of the primary health cares or the teaching hospitals that are run by the states. And that in itself, you are sure of the source of the product, you are sure of getting good pricing, and you are sure of timely delivery.
The factors within our control, yes, we can jump over it, we can navigate and ensure that we stay true to our commitment to all the DMAs of timely supplies, of optimizing our existing warehouse infrastructure, inventory, positioning, all of this we can put in place. However, factors beyond our control, poor road network, which could delay logistics to the different DMAs. We also have the security challenges. These are factors that are not within our control.
And so in 2022, when they started, we had only 6 states with drug management agencies. As of today, we have 27 states, right? So that in itself, it's a milestone, and it's something that as a country we should be proud of. Our goal is to ensure that all states get to establish their drug management agencies backed by law. The second milestone, of course, was then that each of the states was able to sign an agreement, midwife by AKSM, directly with manufacturers. And for us as commissioners, that was critical. It guaranteed the quality of the commodities that were coming into the state. It guaranteed the consistency of the commodities that were coming into the state. So it meant that facilities would have drugs and there will be no stockouts. It guaranteed that we could stabilize prices, right? So elsewhile, you would have procured from distributors with different prices based on the cycle or a monthly basis. We could guarantee commodity prices for a period. And so that worked well for a period of time. And then we evolved into the process, what we're talking about now.
Encourage all the companies to see whether it's the model of we have a central warehouse, states can come and pick, or the drug distribution hub model, where companies can share warehousing space, like Prince Emeka has said, or what Madam Obayemi is saying. If we group purchase, have a framework for logistic provider and share it, it will reduce the cost of transportation.
I want to say this program is a big success in peer learning with our other states, other DMEs, where we kind of guide, support, and educate each other to see that we achieve universal health coverage for the state. So the GPF has done well, and it has enabled the DMAs to get quality and affordable drugs meaning that there's medicine security and we'll have universal health coverage by all.
We become a powerful convening because then we have CEOs of companies, stakeholders in the health systems who are also deeply interested in seeing how we expand access to essential medicines. One of the things that the breakfast meeting has done is that it's consistently put forward the need to have the conversations going on consistently between government and the private sector. And what we've seen so far is that it's become a place where we're able to discuss, plan together, of course, shape the economy and the markets for the pharmaceutical industry and, of course, the users in the country.
The DMAs who have held the rails, right, in moving this. Again, like I say, you can talk about policy, you can set up the initial phase. If people don't run with it, it just becomes English. Oh, we tried. So we really must appreciate you and Pharmaceutical and team, AA, everyone who is here. Thank you so much for the work that you are doing. And we look forward to the aggressiveness that you have to continue to push it. You can be rest assured we will support you, we will back you to get this to the right path.